Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. This show was developed as a resource from the Association of Community Cancer Centers. And on this channel, we aim to bring you the latest news and emergent issues in oncology in just a few minutes. Today, a look at the IT professional's role on the multidisciplinary cancer care team. The pandemic, of course, pushed healthcare information technology to the forefront as the use of direct-to-consumer telehealth skyrocketed. However, even before the pandemic, IT has been at the foundation of modern cancer care delivery, and it's all throughout the care continuum, from the EHR to data collection, education, tumor boards, workflows, patient portals, and on and on. In fact, you might not even think about it all the time, but our guest today says that every aspect of the patient experience utilizes IT. Brian Dunn is the Unified Communications Engineer for Teleoncology at UVA Health at the Karen S. Ruban Center for Telehealth. Brian's worked in teleoncology for years as a full-time employee of the Cancer Center. Hi, Brian. Nice to see you today.
Thank you for having me.
Let's talk about the transition of IT during the pandemic. You have a really unique experience on that.
Sure. So prior to the pandemic, telehealth was, we utilized telehealth at UVA to see patients in far remote places in the state of Virginia. We have partner clinics all throughout the state. But since the pandemic, we really saw a huge uptake in telehealth, but not necessarily to clinics, more to the patient homes in that direct-to-consumer fashion. But we also saw telehealth really increase in our inpatient spaces and from facility to facility where necessary.
So your role at UVA expanded as well during the pandemic. As COVID-19 recedes, where do you see things headed?
Well, I really hope that telehealth continues to grow as the pandemic recedes. Telehealth has been around for a long time at UVA. It's actually existed for about 26 years. But we really hope that now that there's value, the value has been seen for telehealth, that we'll continue to see it grow really into the future, especially for cancer care.
There was a recent conversation on the ACCC exchange that suggested that possibly due to the psychosocial issues when it comes to cancer, that continued telehealth might not be the most appropriate method for oncology care. What do you think about that?
Well, it's definitely a very valid comment. Each patient is going to be completely different. For some patients, they may want to have everything back in person again. But many of our cancer patients are also some of our sickest patients. And telehealth really gives an opportunity to maybe lessen the burden of travel. At UVA, some of our cancer patients will travel as many as 6 or 7 hours one way. And for some conversations that are exactly that, they're conversations, it may be well suited for telehealth even moving forward. Sometimes what you get back in energy and what you get back in your day and in your care, your caregiver's time can really tip that balance.
Let's switch gears now, Brian. How does the inclusion of IT under the umbrella of the multidisciplinary team benefit the cancer program and then ultimately the patients?
Well, anytime you incorporate IT, especially now that IT is ingrained in many functions, it really lets us customize and really integrate within clinical workflows and really within patient experience. It allows us to fix problems as they arise, but it also allows us to help care providers innovate and really push the boundaries and do new and creative things for their patients.
How do we establish effective communication between the IT professional or the IT team and the Cancer Center? Do you have any best practices that keep that relationship and communication close?
Well, that is definitely a very big challenge. I have always found that as long as you're keeping the IT professional and every member of the team engaged at all times, and you keep a very consistent and methodical communication, it really brings everybody together and it really shows that we are all here for the same reason and we find ways to help each other out. And in IT, that's very important because, again, it allows us to see things as they come and really fix problems and really innovate and grow.
What do programs with less resources do if they don't have access to a dedicated IT professional? How can they avoid being caught on the wrong side of a digital divide?
Another very great question. The digital divide is vast, especially in rural communities where a lot of lower resourced centers are. And so, many times IT professionals can be spread out across all systems and really not be able to focus on one thing in particular. And in that case, a lot of systems that may not have the resources may have to look for a vendor or an outside resource that is able to build custom technologies. And hopefully they listen to their customer well and really fine tune for their patient population and their geographical area.
Thank you so much, Brian, for your insight.
Thank you for having me.
You can find more resources on the Adoption and Expansion of Telehealth Solutions project webpage on the ACCC website at accc-cancer.org/telehealth. On behalf of all of us here at Cancer Buzz TV, thank you for watching today. I'm Summer Johnson.